Peace FM 104.3. Good to meet you.
Nedi kind of my man fan check as sombrero. Na me mama basso. And the way treated that time. You know, fan chairman soon Nibia, they wasted time. Chairman, me and late call almost midnight from our producers. I mean, poker me catch on Zano Pen, I'm a co baby, but me try a banter. Near some is neither here nor there. Chairman General, I'm a NDC Communications Officer. But I'm going to start if you baby or no cast and your copy sika and the project, no, not just a project. But let me start with that analogy. What far from me, Kumeu, Bequai, European town. The funding for these hospitals all can once from the Kufuor time, President Kufuor, a source for funding.
No, that's not for me. Chief, can't you reject? Not for MENA. It's not true.
I'm telling you.
For MENA is males. Is at John Mahama, please. Can't you reject? That's a Afari, Upper West. If that's what you're talking about, fine.
Fair. Me o kasaranya zeni aka bebre ni hwe kan o wote dem a poison ade go atmosphere so take a chill pill ne enkoso o say NPP so by just start hwe ni enye hwe. Me this discussion poko and I'm trying as much as possible say men the discussion is about the number of hospitals and as how flashy a building is, but offer to say projects in be ho. University of Ghana to say phase 2 of the medical center. I started in May 2019. It's expected say in the next few weeks, you bear commission the phase 2 of the University of Ghana hospital. Over the construction of South 5 district hospitals, Yashas was Sola, Tolong, so many, Bupe, Anyweta, a polyclinic also in Bamboy, President Mahama Kroma. And we are starting in August 2018. A bunch of chef from Noir at the buyer of Betina Kunyaso. No Casa project na aircon anymore. You share him say in the next few weeks, I in Chekrano and also soon we have a commission. Chairman, we don't call the construction of 5 and upgrading of 1 public health facilities. Yes, share bossy a bay in the western region. A Contombra, a Lubo, Bogoso, Mpoho, Nsiayem, Wasadunkwa. I know your shots here in December 2019. We are hoping and praying. So once your PC card, your shots here, some agent
4 months ago.
Oh, Tobo. So what to about my one to about my for 1 year? It's a term of office. Until after 4 years, you boom one contact. You have 10 years, one contact. As we speak, no. A year contractor on site, on site since July 2019. It's expected to say Achano by December 2024. Now and several of these projects have been able 2021, 2022. Bebre, maybe I made a Mahama. Offer beat is a construction of Eastern Regional Hospital, Leokofredia. Yeah, hear him say the conclusion of the loan home comma yet be and Minister of Finance. I also so know Yasha Hunyumas. Hopefully by December 2022, then also your team area cabinet so no cabinet and parliamentary approvals for Obuasi and Yinemni NUC construction of district hospitals Yadeko Obuasi and Yinem trauma hospital and rehabilitation of NUC government hospital. Kwame several. I won't even go into that argument of Sammi Awuku. It's a comfort zone. Say or be enough propaganda to distract us. All over the world, hospitals and sayare. Person what them with na Chairman General yet here. No matter how beautiful a hospital building ete, who could remna say or one na akawa. Na you need or one akawa no draw. Kwame, you'll be sleeping on whichever mattress will be. So soon as a hospital building, so no AC. Now say when ya and one cardi be equipment, any human beings are almost be manage the equipment what the say The reason why and these many of the hospitals medical almost say ebu also almost say so empty was that now omonia can there and the sikaso na any economy nim for you to be able to say one obeto equipment not edie and answer two Ubetimi so no afa health personnel be manage these hospitals. And that is why the NDC's program any healthcare infrastructure no failure. Yama clearance for several health workers are abaya farm, emu doctors, emu nurses, emu midwives, emu psychologists, emu several. And you have all these people sending your government's affordable healthcare, any healthcare delivery. Nipa nebet me a pay. What shall it profit a country where when your hospitals where CCH bush? Nani pana semwa to no when your ambulance and them no that or the car boot are facilities be anymore a bit me abuano to support the very existence. And of course, without a strong and resilient economy, you cannot achieve your dream. So the basic healthcare facilities are obe making sure say up to date. Imagine say under the NDC na ki one now with this coronavirus pandemic, a new chinya doa, a new maboy yarefo no nim sikani. Na ato emra na yesa wo dum so mu so ka ho. Because what they imagine. Now your very life depending on a ventilator. Uti anya yenu anya ambulance and nem yare dokowa. Not just a wono who fate is in the hands of a taxi driver. Not trotro driver. And as a car, any facility bit me on support or life. I do call hospital. Who could do also so a hospital bed so near say doom light and I say doom. That was what we were. That was the kind of administration we faced. But we could make a point. Say it will not be fair to compare cholera pandemic, Ebola to that of corona. Ebola there, MZNA defined to a geographical location. Tinane spread, and you're wide, sir. But even with Ebola, the U.S. Foreign Service, our money NDC Abanye Juma during that time, made a very interesting comment. Penimo Bakuana or no lead partner, Jim Beaver, no was serving for 35 years at the Foreign Service. Also now Ghanaian government. Any idea, it was clear that now they were not serious about how a pandemic we be fighting. And I quote, was yet the pace of the plan's implementation was slow. We were concerned that 2 or 3 levels down, the government of Ghana did not seem to share our sense of urgency or that of its official donor, which is USA. The people's knowledge about Ebola, where Ebola kekeo, and about the cultural and behavioral changes that would be needed to contain a possible outbreak was still minimal. Or said the press was full of outbreak rumors. Unlike our situation now, almost every week you have the president of the land leading the narrative, backed by data and evidence. Or catch us a hand yedu, or no year. The institutions and the institutions of state, Ministry of Information, Ministry of Health, they'll go a step further. Now, also, I'm making sure say health experts are more and health experts they can have something important to add to the discussion. Say, Niamani be a church now, so they are baba tuja. Kwame, in spite of all this, NDC force abana nyewe. Kwekuza mi afa cholera account, which I agree, say you compare. You be a mistake, but I grow best one if you pa. If a government that cannot even manage a cholera outbreak in 2014 from April, according to the Ghana Health Service, cholera from April 2014 to October 2014, the number of people are almost infected with cholera in the 10 regions of Ghana, 24,648. Out of this 24,203 over cholera. It's Nippon to manage cholera, a government and administration to manage cholera. Except for coronavirus pandemic, no manager. Then it's just simply our passport and they fast track us to our graves. Now you are talking about back to your healthcare infrastructure. We don't have the best of healthcare facilities than US, than Italy, than Spain, than Iran. As far as I speak to you, these countries are mabobo mudino. Kwame, they are on their knees. To the extent said they are beginning to even rely on people outside their jurisdiction for help. It's just like school buildings. School buildings in Chiradia. In Siho no more who a problem. But when you see one one pen crofobia kwakwa kwesi prad can as a uchapo. Me where I want the discussion to go. And I know the answer now because second way quickly, may they come in an argument, Sir, I've heard Mr. Mahama, the former Ghanaian leader, saying
Peace FM 104.3. Good to meet you.